I'm starting your 2 minutes here. Yes, you can start there.
Okay. Hello, I'm Dr. Priyanka, one of the doctors in the Central ward today. Can I confirm your full name and age, please?
Hello, doctor. This is Sarah Smith. I'm 32.
Okay. So, how may I address you?
You can call me Sarah.
Okay. Sarah, I can see that from your note that you have been admitted and you are feeling unwell and you have a history of rupture of the membrane to respect.
That,
And is that right?
yeah, that is right, doctor.
Okay. So, any other concern or expectation from this consultation you want to know?
Yeah, I had been having this greenish type of discharge and I don't feel quite well. I wanted to know what is happening.
Okay. Okay, sir, surely I will give all of your answers in a few while. But before that, can I ask a few questions to know more about you? And after that, we'll discuss your management plan. And
Yeah,
also,
sure,
I will
sure.
involve my consultant. Is that okay?
Yeah, sure.
Okay. Okay, Sarah, first of all, could you give me some details of your discharge that you have been experiencing for 2 weeks?
Uh, doctor, I'm not feeling quite well.
Okay. Okay. Do you need any do you have any pain or at the moment do you have any
Uh,
fever?
yeah, I think I'm running fever for 2 days now. And yeah, I think I'm going to be sick. Oh,
Okay, okay, okay. So, do you need any antipyretic medication to relieve your fever or antiemetics
I
at the
don't
moment?
understand what that means. See, I have fever and I want to throw up. Uh,
Okay, okay, okay. I'm asking my nurse to give you some anti-sickness medications. Do you have any allergy?
no, thank you so much. Yeah,
Okay,
I think I'm
okay.
better now.
Let me
Yeah,
tell when you are okay.
yeah, I'm better now, please.
Okay, okay. Can you proceed?
Yes, please.
Okay. Sarah, how long you are experiencing this discharge from down below? Can you give me
It's
the
been
details?
from 2 days now, and 2 days I had been having fever for on and off now. This discharge, it's really foul smelling.
Mm-hmm. Mm-hmm. Okay. And so is it associated with any pain in your tummy?
Vague, I wouldn't call it pain, but I don't feel it's like contractions, but I feel a very kind of vague pain.
Okay. And how is the water and the bowel habit?
Been no issues there.
Okay. And have you taken any medications to control the fever or for this?
Not for fever, but they gave me antibiotics and it's complete now.
Okay. And the discharge, is it foul smelling?
Yeah, yeah, that's what I had been saying.
Okay. Okay. Could you give me the details of your pregnancy more?
Yeah, this is my this pregnancy. We had been hoping it would be a good one, and we named our baby Theo, and it's been going on well. But
Mm-hmm.
then 2 weeks back, I had this gush of fluids, and I came in, and they told me that the waters have broken. But I didn't know what it means because it
Mm-hmm.
was so early. Then they told there is a possibility that this could go on and the baby can grow inside under continuous monitoring. They started me on antibiotics. I had been taking it and it's been over. But I don't know how, because despite giving antibiotics, I feel feverish and I don't know what is happening to me
Mm-hmm.
now. Is my baby doing well
Okay.
all right now?
Yeah, Sarah, I'm here to discuss all of your concerns and I'm here to help and support you. Don't be so upset. Is that okay?
Yeah, yeah, thank you.
Okay. Okay. Sarah, so is it your first pregnancy?
No, it's third. It's my third.
Okay. Could you give me the details of your previous pregnancy?
I have had two previous losses. One was at around 12 weeks and another one at 18 weeks. Both of them had a similar type of events. I had
Mm-hmm.
this gush of water followed by loss of pregnancy, and I really, really
Mm-hmm.
hope this will be fine.
Okay, I'm so sorry to hear about that. Is there any complication happen at the time?
No, nothing as such. Everything had been fine. The previous tests had been fine. Baby was growing well, and suddenly something like this would happen. And
Mhm.
I don't know whether it's the same thing. And I want to carry this pregnancy. I want this at any cost.
Yeah, I acknowledge your concerns, and I'm sorry that you have been a person with this difficult time. But I want to assure you that I will be with you in your total journey. Is that okay? Okay, Sarah. So, do you have any other history, any medical history of concern?
Not that I know of, no.
Any surgery in your tummy or down below, especially in the neck of the womb?
Yeah, I had this LETS procedure last year, but that went well.
Okay. So, after that, your smear testing is normal.
Yeah, the follow-up was fine. Yes. Thank you for asking.
Okay. And do you have any allergy to anything?
No.
Okay. And what is your blood group?
So positive?
Okay. Any reservation for blood transfusion if needed?
No.
Okay. And is it your planned pregnancy?
Yeah, we were planning, yes.
Okay. And, okay. And who is there to support you?
Yes, I have my partner. He's with me.
Okay. So, yeah. Sarah, thank you for all the information. Sarah, I want to just examine you in principal check room. My nurse will take your observation, your pulse, blood pressure, temperature, and also I will look down below and also tummy to feel any tender area there, and also down below. If there are any discharge present, then I'll take the swab from there. Is that okay?
Yeah, will there be somebody with me? I'm scared.
Okay. If you want, your partner can join, or if you want, I can call my midwife with you. Is that okay?
Okay, thank you.
Okay. So, Sarah, thank you for the cooperation. Now, coming to your concerns, before going to discuss of your um of your condition, do you want your partner to join with us?
No, that's all right. Please tell me. I really want to continue with this
Okay.
pregnancy. Is there something wrong? Because previously I had been starting to feel a good amount of movements per day, and right now I
Mhm.
don't feel much.
Okay. Okay, Sarah, I will explain all of your concerns in a moment. But let me reassure you, we'll be here to help and support you. Is that okay?
Yeah, sure.
Okay, Sarah. So the thing is that normally, if usually a woman, see, I'm explaining this with this diagram. This is the womb and this is the neck of the womb. Normally, this neck of the womb is usually opens or yeah, opens up, or this bag of membrane that contains the baby. Usually, it also contains the water around the baby. Usually,
Yeah,
it
I know that. I
ruptures.
know, I know all these things, doctor, because 2 weeks
Okay.
back when I came in, these things were discussed with me.
Mhm.
I want to know right now
Okay.
what is this greenish discharge about and why am I feeling so unwell?
Yes, okay. So, I acknowledge that you have known all these things. That is the thing that you have gone into the premature rupture of the membrane. That is that your membrane is ruptured, and so that the things that as the membrane is ruptured, so the infection can easily get access to your the into the baby. So and also affect the
So
afterbirth.
you,
So, this
so you
condition
mean
in
to
a
say
medical
my
term.
my baby is having this infection now? But then I took the antibiotics. Why is this
Yes.
happening?
So it might be sometimes antibiotics are given, but sometimes it seems that the infection, despite giving the antibiotics, infection can happen, and we call this, it affects the afterbirth as well, as the membrane is broken. So it is called the
Mhm.
chorioamnionitis, and it seems that you are having a severe infection in your blood as well. We call it as sepsis, but we are not sure at the moment. We have to run some tests to make sure this. Am I clear so far?
Okay.
Okay, so for this, first of all, we will need to shift you to the a high dependency unit, and the team of doctors will be looking after you. That include my consultant and the baby doctor, and also the infection specialist doctor and your midwife as well. And first of all, we'll give you some injectable antibiotics, broad spectrum, as we are suspecting that you are having this infection, and also give you the fluid and the oxygen, and send some investigation, that is blood culture, the blood lactic level, and also the your vaginal swab, and some urine test, and the full blood count. Am I clear so far?
Yeah, sure. Anything to save my baby.
Yes, that coming to baby. So the thing is that as you are develop this infection, the sepsis might be, and if the possible source is the baby, that is the and after birth. So we might need to expedite the delivery. So, but
What?
as your
No,
baby is only,
no,
I'm
no.
sorry to
I would
say
like
that.
to. No, I see. I don't understand why. What is happening here? I know. Okay, infection. You can give antibiotics, and why should I be delivering now? I want to carry the baby as many days as possible. I want the baby at any cost, doctor.
Yeah, I actually acknowledge your concern and I will respect your decision. Nothing will be done without your permission. But let me tell you, your safety is our first priority. Because of your safety, if the infection doesn't control, then we might need to expedite the delivery to deliver your baby. It might be an option to save your life if the infection doesn't control. Am I clear?
God.
I'm sorry to say that.
Oh my God. So what are the chances that my baby will survive? I know it's been only 2 weeks, but I wanted as much as time for the baby as possible.
Yes, Sarah, I'm very much sorry to say that, but I would be open and honest to you. If baby is delivered at this point, the survival rate is very low because only 4 to 5 out of 100 100 baby will survive. But I would also inform my baby doctor who will be here to discuss with you about the further options of the baby's management. But most of the time, the babies may need give some supportive treatment, but the survival rate is very low. That is 4 to 5 out of 100. I'm sorry to give you that information.
Devastating, doctor. Oh my God. Is there a possibility where I can deliver by cesarean section that will make the baby survival better?
Sarah, there is a possibility that we can go for cesarean section if the survival rate is high. But if you go for the cesarean section, it will not change the survival rate as well. Or rather than your future pregnancy will be also hampered due to the complications of the further placental afterbirth problem or the chance of scar dehiscence. Am I
What
clear
does it
so far?
what does it mean? I don't understand. But it was okay. Then what will happen to my stitch now? They had inserted the stitch around 16 weeks or so.
Okay. So as they inserted have you given any stitch around the your neck of the womb?
Yeah. They told it was short because I underwent this less procedure, so they inserted the
Mhm.
stitch.
Okay, so for this now, after control of the infection, we will remove this stitch so that you can deliver the baby easily if it is progressing to the that, and uh, and we'll also give you this prophylactic antibiotics. So yes, we have to remove this stitch.
Mhm.
Am I clear, Sarah?
I don't understand. I don't know why all these things are happening to me. I just wanted to have a baby who's hale and healthy. Is that
Sarah,
something
we are
that I
really
did?
sorry.
Yeah.
No, Sarah, don't blame yourself. You didn't do anything, or you cannot do to prevent it. But the thing is that when the neck of the womb is shorted, sometimes it might be the predisposing factor for the a loss of the baby. But in the next pregnancy, when will be filthy? I know it is the not right time, but when this pregnancy will be over, we will refer you to the prevention clinic, that is a specialist clinic in the next pregnancy, who will give you the next care to hold the pregnancy as early you have the pregnancy in the next. Do you
Yeah.
want to know anything?
What do I do now? What next?
Okay.
Yes.
Sarah, at the moment, okay, so I'm giving you all this, documenting all this and giving you this uh, I'm making arrangement for shifting you to the SDO and all these arrangement for giving you the antibiotics and the investigations, and I'm also informing my consultant in this and also involving the neurologist in this in your care. Anything you want to know?
That's it, doctor. Thank you. You have been helpful.
Okay, thank you. Thank you for letting me explain.
Yeah. Very well done, Dr. Priyanka.
No, I'm just prepared. Just I said those things that I have do in my real practice.
No, Doctor
That-
Priyanka, actually, you are doing very well. See, it's something that's thrown at you, how you deal with it. That's it. It's a practice.
Now,
Yes,
please
yes.
go ahead, Meera.
Okay, Priyanka, you tell me how it went.
Initially, it was fine, but in the last, I think it was not so good.
Yeah, when I gave you the information that I put in the stitch, right?
Yeah.
Yeah. I think because this is specific information, you can elicit it in any of the PPROM stations. Because for this pregnancy, has any stitch been inserted? Because there had been a LETS procedure and previous 2 losses also. I think you can give a closed end question there. And as for the lay examiner feedback, I was heard and your starting was all right. You made me feel comfortable and you allowed me to speak and you supported me emotionally also. Several times you mentioned that you are there to support me and you offered the support of my partner also. And the actual whatever I wanted to do, this was, given respect. And at the same time, you show that continuing with the pregnancy is going to be risky for the life, which is why we offer this kind of treatment. But then finally, the decision is going to be yours. Nothing will be done apart and away from whatever you consent for. So that you gave in. So this is the balance between autonomy and the non-maleficence. Just because she is asking for something that is an unsafe option, it's not like you just leave it and go. You have to give her the risks and
Yes.
benefits of going ahead. And this more non-maleficence is the principle which needs to be emphasized here in the station. So that went well. So certain things like making me comfortable initially. So any feeling unwell, even you expect that this is chorioamnionitis and you know about the station previously, you ask her currently if she is doing well. So the current concern, any acute concern she has, and give a specific question there and make her feel comfortable, and ask the story from her. Can you tell me what brought you here so far? How can you tell me in your own words what happened so far? So that will help you with the whole story. Before that, you actually asked specific 2-3 questions and then you set an agenda and you let me talk. So make sure that you let me talk initially, and with that in mind, you go into setting an agenda so that I will feel heard. And certain questions like whether this pregnancy was planned, because I already told this is a very special pregnancy for me. I need to carry this pregnancy. I may want this baby at any cost. Despite saying all this, you asked whether this was a planned pregnancy. Certain questions like this can be, just overlooked and you can just leave it off. And you can take some moment also to think. You need not be asking questions or talking throughout the station also. Just take a moment or two to ask what further questions you want to do. All right. So these filler questions, don't ask these. And for offering examination, make sure you mention the chaperone. With your consent, I'll be offering you an examination. I don't know whether you told that, because I thought you did not say that. That's why I told I'm feeling uncomfortable. I want somebody by my side. Okay. So that is from my side. I felt that I was respected. My choices were respected. At the same time, you were able to balance the risks of continuing the pregnancy, and the explanation, not much use jargon, but there. So overall, it was fine. Over to Sumi.
Dr. Priyanka. Even from my side, you did cover most of the important points. Just a few fine-tuning will be enough, dear. First, I shall just give my key, like whatever I have, the notes that I've written, and then we'll go through the key, and then we'll go through the ideal case scenario. So, are you with me, dear? So overall, it was you had you had told what are the important points. You took the right decision, and you provided the support, emotional support, also to the patient. Now let's move on to how to improve this station, how to improve the time management and your communication skills as well. So in the beginning itself, when she had told like she was having this pains and she's very worried about her baby, at that time itself, you can acknowledge her emotions and provide her some support. Ask her whether she's with someone. This will give you points with the lay examiner related to communication with the patients. You can always offer support early on. And it is also necessary to provide her an emotional support. Like, I can see that this must be very difficult for you. You must have some, some sentences or points to tell when the patient is anxious. We are here to support you. You must have something. And at that time, you did use words such as antipyretics and antiemetics, which are jargons. And once the patient asked, you did correct it. Make sure you do not make this again, dear. And you asked whether it's a foul spelling discharge. Already the patient had told you, and you again told that it is whether asked her whether it's foul smelling. This question, maybe you did not, give attention to when Meera told you in the beginning itself. And important history you did not ask, dear, which is you did not ask her fetal moments, though it is just 21 weeks. She might be feeling it. It's better to ask about the baby as well. This history has been missed. And again, when she was telling, I'm very worried and all that, you were telling, don't be upset. I never use this kind of phrases like don't be upset. This is instead of that, you can use phrases like I can see you are upset, you are very anxious, you are worried about your baby. And you can add on like we are here to support you. Would you like to have someone with you? And we shall take you through this. We shall give you the best management plan, the ideal plan, which is safe and effective. You must have some 2 3 sentences to address her emotions, acknowledge her concerns, and then address her emotions. This needs to be changed here. And then again, Meera had went on to explain about her previous pregnancy details. She was telling you like I had 2 pregnancy losses. You could have asked a little more of the history, like what happened, any reason. Just an open question could have been asked. Though whether they tell you or not, whether if there is any reason or not, it's better to ask one question. And then you did tell her sorry, but this had come a little late. You can tell it in the beginning itself. Oh, I'm so sorry. This must have been very difficult for you. How are you coping with it? And also, it is very important to change your tone. You must, reduce your tone at this kind of situations. That means that you are showing a lot of concern for the patient. These things, if you give a little more importance related to emotional support to the patient, this will help you a lot there. And again, you had asked related to allergies in the beginning. Again, you had asked again in the information gathering. I'm telling you why I'm telling you all this is that this will all save your time, dear. With the continued practice, you will be able to do this.
Okay, ma'am.
Yeah. And then information gathering went on for 7 minutes. So how you could improve with this is, reducing the repetition of the questions. And early on, you can ask her an open question. Once she said about her concerns and expectations, there itself you can offer the support and then give her, acknowledge her emotions. And then again, immediately go on to her pregnancy symptoms. You had given her the support, you had acknowledged her emotions. That's over. Next, go on to the pregnancy symptoms. Just ask her an open question. She will tell you everything. You need some more questions, then you can further on ask her. And the baby history has been missed, which needs to be taken care of, dear. To the discussion. Here again, immediately while discussing, I see you are alone. Would you like to have someone with you, or anything? You just need to offer her that support. And then go on to, you explained using this diagram. You can, before that, you can ask her about what she already knows about this. Then she will tell you something, no? Like, previously they have explained to me that my neck of the womb may be open, it can progress, or it can go on further for an infection. She will tell you something related to that. From that, you can add on. Then you can tell her what is the explaining chorioamnionitis. You did explain it very well, dear. You told that the infection is ascending. It can affect the baby and the mother as well. That was told very well. But you can also, at that same time, you can also tell her what kind of an emergency it is. It is, we need to take action immediately. If you had told that, stressed upon the importance of immediate action at that time itself, then the patient, it might not be necessary to repeat it again. You can tell like the infection can be spreading. This can endanger the mother's and the baby's life as well. And hence it is necessary to take the action immediately. And then the patient will be like, what will you be doing? Then you will have to tell her, we will have to further proceed to the planning for the delivery. And then yes, then she will go on to, what about my baby? At that time, you can, you did explain about the survival of the baby as well. You were transparent, and you did explain it in a good way. But this can also be, refined a little bit better. I can see this must be very difficult for you, since you had previous losses as well. This baby must be really special to you. But at the moment, your safety and the baby's safety is the topmost priority here. You did explain it, but a little more refinement is necessary. Since this is a very patient is very anxious and very sad, it's necessary to acknowledge the emotions then and there. And after that, you did MDT, all that was done, it was fine. And the entire station went on for 14 minutes. So it's very important to cut short on the information gathering. See, you can see that it was around 7 minutes, the information gathering. If you had been very specific in your questions, it could be reduced to 3 minutes, and you would have got almost 7 minutes for the discussion and explanation of her management plan. You're able to see the key? Hi, anyone?
Yes, yes, yes.
Yeah. So this would be the domain-wise key. We shall start with what are the core points, that is the most important points that needs to be discussed by the role player. Like in the beginning, acknowledging her emotions, the patient's emotions is very important. This did happen a little late. It's more important to acknowledge and validate her emotions in the beginning itself. That will make her feel more safe. And she will trust you in the beginning. And they will, open up very soon. They will give you all the information. And sometimes they can also give you some questions that you did not ask, you forgot also. They will give you all the histories without your asking also. That is why it's very important to make the role player feel comfortable in the beginning. And you did a diagnosis, a clinical chorioamnionitis, you did diagnose it with the help of the discharge pain and the fever. And you explained how maternal safety is very important to save her life, and we cannot wait any further. And then addressing all her 3 specific questions, this needed a little more refinement. And outlining the plan, escalation, MDT, sepsis 6 protocol, all this was very beautifully explained here. And next, going on to the information gathering, all the symptoms related to her chorioamnionitis was asked. Only thing, the fetal well-being has been missed. And then Let's procedure, you did ask about her. Only thing you did miss whether there was any surgery done for this pregnancy. Maybe sometimes the role players are explained to not to disclose certain histories unless it has been asked. So it is important to ask such histories. If there is a history of, let's ask for a history of cervical stitch, or any previous losses, ask for a history of cervical stitch. That is, if there were 3 losses, then you can ask for a stitch if anything was present. And she did tell you about the 2 previous losses. Only thing, a little more, probing of the history could have been better. And acknowledging, that is, addressing her emotions, giving her support at that point is very important. And then you did ask about all the other relevant histories. Next, going on to patient safety, that was very well done. Sepsis protocol, emergency, then prioritizing the maternal safety. This was all done very beautifully, dear. And again, you did explain about the fetal prognosis as well. That was also done well, but it could be refined a little bit better, like how I had explained to you previously. Yeah, this sepsis
Yes,
protocol.
ma'am. I took longer time in the history, so I think this would be less.
Yeah,
The
yeah,
history
yeah.
has been taken as a longer time.
It was almost for 7 minutes, right? That is why. You can do it, dear. You can do it with practice. And incident reporting could have been mentioned. VT, risk assessment, management, all these points needs to be covered. Then communication with colleagues, HDU, then specialist input, all this was covered. Documentation, yes, you did tell, only MEOS chart had been missed. And a very important thing, putting her in touch with support services, giving her any bereavement midwife or counseling support, counselors, this had been missed. This could be because of the, for the time management. And communication with the patients, it was open, honest, non-judgmental. A little more refinement of communication with patients. You need to concentrate on that, dear. And there should not be no use of a jargon. And acknowledging emotions, validating concerns, all these needs a little more improvement. Then questions, here the Mira did ask you about the antibiotics. They had given me antibiotics, but still, why am I having the infection? You could have told it this way, like it does delay the infection, but it cannot entirely stop, that is, block the infection. In that way, you would have completely answered her question. And related to the baby, yes, you did tell her that this is unsafe to carry on with the pregnancy. And then baby surviving, this was very well explained. And the tone and clarity, it is important to reduce your tone, and while talking, go a little bit slower while explaining any sensitive issues. That would show that you're giving importance to the patient's concerns and emotions. And applied clinical knowledge, it was done well. Mode of delivery, you could have explained a little bit better. We'll check on the sepsis about, what is that, how serious it is, and based upon how much time we can wait, check the, cervix Bishop score. According to that, the mode of delivery will be decided. We will always try for a vaginal delivery. If not, if there is any concerns, we will be going in for a cesarean section. That needs to be mentioned in a little more in detail. Actually, Mira had asked you also about that, but this was not given much importance. And now let us go on to the ideal scenario, like how to go about this station. So the first 1 minute introduction and agenda setting. Introduction, then identity confirmation, acknowledge the distress, concerns and expectations, and then set an agenda that I'll be asking you questions. Then we'll be going through the management plan. And further on, here again, the ideas, concerns, and expectations has been asked. What worries you most today? And then further on, go on to the symptoms, fevers, pain, discharge, leaking, and bleeding, fetal movements, whether she's feeling unwell, and since when all these symptoms have been there. These are all important questions to be asked related to chorioamnionitis. Further on, go on to the further previous pregnancies and all other relevant histories, previous pregnancy losses, and the Let's procedure, and all the BMI, blood group reservations, all that needs to be covered, medical and surgical histories. Then next, once the 3 minutes are done, next 3 to 5 minutes, the next 2 minutes, you need to summarize and explain what has happened, the importance, the emergency, how soon we need to act. All this needs to be explained in the next 2 minutes. What is chorioamnionitis? Ask her what is the background knowledge, will help you to, where to start the explanation, and then explain the ascending infection, and explain the seriousness and the emergency situation. Next, how is it emergent? That is why we need to act immediately. What are the risks involved? Maternal and fetal. You can explain it in this way, like it is associated with risk to both the mother and the baby. the end, you will be explaining what you will be doing, escalation, senior MDT review, and what are the other tests you'll be doing. You'll be closely monitored, and delivery will be planned. You did explain maternal safety is the priority. This point has been mentioned. That is very good. And again, so definitive management, delivery, and following that, continuous monitoring of the mother. Next, you did explain about the poor prognosis of the baby, significant risk of death, and emotional and compassionate counseling. At the end, again, summarize, involve all the MDT and emotional support, bereavement services, counselors, all this can be added. At the end, ask some questions and tell her that we'll be taking arrangements to plan your admission and into the HDU and planning your delivery, take some blood tests and further on. So this is the tabular column to tell you about the survival according to the weeks. You can just go through this later here. Dr. Priyanka, what you need to concentrate upon is communication with the patients, dear. You need to, practice on acknowledging her emotions, providing her support, changing the tone. That is very important. I think that is what you need to concentrate upon now. The others are just fine.
Little bit
fine.
voice was a little bit monotonous, I think. Right?
Yeah.
You need to act a little bit more, like bring in more emotions.
Okay, I'll take care of it.
Sure. I'm sure you will do.
And your attitude to take up the task, even if it is just in the last minute, all this is very good. This will definitely help you in your preparation, dear. This is how you need to practice without knowing what the role player says, what the task is about. This will help you a lot, dear.
And Dr. Shruti, you mentioned about the three management options for the preterm birth, for the PPROM, I think. Preterm birth, I think you mentioned. But this will not be applicable here. Probably this might be the option when she came in the initial time, when her waters broke initially. Probably at that time, she can be given options. But right now, even if this is against her autonomy, you would need to show her that this is something which is serious. So this level of urgency, if you explain it initially, this is an emergency. Life is at risk, which is why we need to act immediately. We will be shifting you to HTU immediately on an urgent basis, and we'll be involving a team of doctors, so that we start the management right away. So within the first hour, we'll be offering you the antibiotics to combat the infection, and we'll be taking some bloods and swabs from down below also to rule out any infection. And at the same time, we'll be starting you on the fluids, and we'll be monitoring you continuously. So this will tell her that this is something serious going on. So the level of urgency is most important to be mentioned here. Yeah. And VT risk assessment and all that, avoiding unsafe drugs, don't forget in any of the sepsis cases. So continuously we'll be monitoring you for risk assessment of clot formation, and we'll be offering you blood thinners or stockings as per necessity.
Yeah, that's very important. And one more point I wanted to ask, I want to tell you, when Meera had told you, like, I want this baby, you just went on to tell like maternal safety is the priority. That is also important, but how you could start is like, definitely your wishes will be respected. Whatever decision you take, we will respect that. But however, I want you to know all the information before you take the decision, and then you go on to explain this. So that will show that you're giving respect to the patient's autonomy. Here, we are not the ones who will be taking the decision. Patient will be taking the decision. It's important that we give them all the, options and the information related to all the options.
At the same time, balancing so that you don't go for the maleficence. So this is like a station where this autonomy and non-maleficence is balanced. Okay, well done.